million New Yorkers need an affordable city. We have lower incomes. Nearly 1/4 of New York City seniors live in poverty. We rely on buses. Half of bus riders are over 50. And we live in rent-stabilized apartments. 1/3 of rent-stabilized households include someone over 62. We're here because we want an affordable city for seniors and for the next generation.
What are some of the issues that are facing senior citizens? Number one, first and foremost, going down the list, is that affordability. Listen, in this city, when we have our pensions and we have our Social Security, affordability is first among equal. Now, it's fixed income. And the only candidate that's talking about affordability and being able for us who have built this city to stay in this city is I can't hear you. Who?
Seniors are the bedrock of the city. Seniors choose to stay where they live in many cases because the city really has been good for us. Sometimes it's been hard, but it's the place to live. It's the place where people have been able to find housing and mass transit so we don't have to deal with cars. And a place where we would love to raise our children and grandchildren and great-grandchildren. But it's getting harder and harder for anyone to live here, and hard for seniors to figure out a way around the city, and hard for people to deal with the cost of housing, and really impossible for younger families to figure out how to have 1 or 2 working parents and pay for daycare and have a good public school system. So we are here because we know those issues better than anybody. We are here because if I ask for show of hands, which I won't do, I bet you on this steps, people represent 15 different countries that you came from, or our parents came from, or our grandparents came from. And we understand that the strength of New York for my children and grandchildren and great-grandchildren is for this to continue to be a city for everyone. A city that welcomes everyone, a city that welcomes immigrants, and a city that provides for our next generation. And I need us to organize with our friends, in our apartments, in our buildings, in our communities, in our senior centers. And we need to show on November 4th that the seniors have it all, and we can compete with the fantastic, brilliant young people who are supporting Zohran. But we will be there in large numbers, and we will help make the difference because we know and we want a city that works for everyone, and that means electing Zohran.
Our rents in our area have risen 34% over the time from 2018 to 2020. Add to that 9% increase over the last 3 years from the Rent Guidelines Board, and you can tell why seniors are being pushed out. Lots of seniors are all over the city are vulnerable to illegal eviction.
That's right.
And those are coming fast and furious. Many of them end up having to go to seedy motels while they're waiting for their day in housing court. We need to speed up the housing court. We need a mayor who is finally going to pay attention to the housing crisis that is spreading in this city. We clearly need Zohran for mayor. All of us standing here feel the rising prices at the grocery store. And we hear from the big CEOs of the big stores that we're going to soon feel the rising prices from the tariffs. Now, which candidate is talking about food insecurity in New York City? Zohran! No other candidate is talking about food insecurity in New York City. No mayoral person has talked about food insecurity since Mayor LaGuardia.
Zohran is committed to better fund our public hospitals and clinics and health department. He has committed to use the power of the mayor to prevent further closures of hospitals and services in already underserved areas. And let me be clear, both Eric Adams and Andrew Cuomo have systematically done the opposite. Our health insurance and healthcare system are so unnecessarily complex to navigate. If you're an older person on Medicare, or a low-income person on Medicaid, or have no health insurance for whatever reason, it's especially hard to navigate the healthcare system. Zohran's commitment to fund outreach workers, to connect New Yorkers to care and services, gets that. If you are working, but your job does not pay a living wage, that is bad for your health, that is bad for your family's health, and Zohran's labor policy gets that. If you're subject to hateful abuse because of religion or skin color or gender, or presenting identity of any sort, that also impacts your health. And Zohran's Department of Community Safety and his health and his hate violence intervention policy gets that.